Good Saturday morning, everyone. Today on Perspectives, when you hear a news program with the words epidemic and crisis, what do you do? Well, we do know that some viewers are ready to close their ears and tune us out. But this time, we're talking about the opiate epidemic. In the age of COVID, the fight against narcotic addiction has not received as much attention in the press, but believe us, the threat has never gone away. And sadly, it has gotten worse. According to the Centers of Disease Control, drug overdose deaths have now topped 100,000 people for the very first time. In fact, the 12-month tally of estimated deaths has now overlapped COVID-19. And today it marks another grim milestone in the U.S. fight against the use of illegal opiates. In addition to the current situation, you will hear of another opiate that has surfaced and is now killing thousands: fentanyl. According to the CDC, fentanyl is 100 times more potent than morphine. What makes it worse, though, is the fentanyl sold on the street is illegally made, which means if an addict or a first-time user buys it, they never know if that will be the dose that kills them. Our guests this morning are Virginia Guy, Executive Director of the Drug Education Council. And also joining her this morning, Don DeSalvo, Resident Agent in charge of the DEA in Mobile. And with us this morning as well, David Grayson, who shares his family's pain with all of us. He lost a daughter to opiate addiction. However, he has now created a Facebook page that is meant to help other families who have found themselves in similar tragic circumstances. This morning, an update on the opiate epidemic as Perspectives continues after this quick break. Our guest this morning, Virginia Guy. She is the Executive Director of the Drug Education Council, and Don DeSalvo, Resident Agent in charge, the DEA in Mobile. But thank you both for being a part of the conversation this morning.
Thank you.
New data released in Virginia. We talked about it briefly by phone a couple of days ago. The drug overdose deaths now topping 100,000 for the first time. How did this hit you when you first heard the report coming down from the national offices?
I really never thought that I'd see anything like this in my lifetime. You know, this is the highest it's ever been in the history of overdose deaths. In fact, it's double what it was in 2015. So this is just really alarming information for our community and for all of our families.
When you look at the role of the Drug Education Council locally, what type of impact did that have when we look at how things are here in Mobile County and this part of Alabama?
Right. We know so many families that are struggling with addiction, and this just makes us want to step up our efforts even more to reach out to the community, to make sure that parents are talking to their kids, families are talking to each other. You know, we want people to talk about this, to explain that there is help available, there's hope available, and that we're here to be able to assist families to find the appropriate, you know, resources for their particular situation.
Looking at it from the law enforcement perspective, Don, when you heard these numbers, what was the sort of conversation in the office?
It's pretty shocking. However, we have been seeing an increase in enforcement operations around the country, particularly with fentanyl. Fentanyl is an extremely potent drug. It's 50 times stronger than heroin. So just a few milligrams of fentanyl can kill a person. So we started to anticipate, obviously, this problem, and our enforcement actions started to pick up. We started to seize counterfeit pills, which are the method. These counterfeit pills contain fentanyl. They look like a actual pharmaceutical drug, but they're mimicking the drug because they don't contain the pharmaceutical ingredient, they contain fentanyl. So individuals obviously are taking these, and we're seizing, I think this year we've seized, DEA, 9 million counterfeit pills.
My goodness.
And that's up exponentially. And our laboratories, the DEA laboratories, have said that 2 out of every 5 pills that they're coming in contact with that we're seizing potentially contain a lethal amount of fentanyl. So that's the reason we're seeing these overdoses. And we just started a public safety campaign called One Pill Can Kill, because if you do not get your pill, if you do not get a pill from a licensed health professional, it could be lethal. It could be, if it's bought on the street, it could contain a lethal amount of fentanyl.
My goodness, you're really putting your life in danger. And I remember seeing a piece on the news about it being made down in Mexico, and this particular area, they were showing the process, and they were talking about how dangerous it was in the making of this drug, to where there are people who die in the process. And so it is really a deadly mimic of the legal drugs. Are we seeing these things sold individually, in packs, in bottles? How does it happen?
They're not sold in bottles generally. They're sold in packs and sold individually. And the chemicals that create these counterfeit pills, the chemicals are coming from China. They're then transported into Mexico, and the traditional drug cartels in Mexico are the ones that are manufacturing these pills, and they're crossing into the border into the United States and then shipped all over the United States, just like a traditional drug would. We started to see these drugs hit our market a few years ago. At first we started to see the heroin mixed with the fentanyl, and then just a few years ago we started to see the counterfeit pills.
My goodness. Virginia, when you hear this information and things have changed and got more deadly, has this changed your message when you talk to especially the kids in the schools, as you have a major outreach to them?
Right. As Don said, one pill can kill. And, that wasn't the case many years ago for the most part. And so now it's so much more serious. So we know that if somebody has gone into treatment for addiction and they come back out and they relapse, that one pill that first time could kill them. So we want families to understand this, individuals to understand this, and we definitely want to talk to the entire community. This is so much more serious than it has ever been, really, in my entire career.
Now, one of the things that we hear from some of the reports is that it's not just the children, in many cases, the parents as well as older relatives that seem to have gotten involved in using these drugs.
Well, that's right. Addiction does not discriminate. It hits all age ranges, gender, racial, ethnicity, everything. It crosses all socioeconomic barriers. So we know that everybody can be at risk for this. So that's why we want the entire community talking about it. We want to educate everybody, particularly our younger people. We also want people to clean out their medicine cabinets. We know that a lot of times that kids get their first use of pills by going in granddaddy's or mom and dad's medicine cabinet. So keep your medicines locked up, dispose of them properly, and just to keep all of our kids safe.
Don, what's the message for the community as relates to the DEA perspective and what you want us to do to help stop this drug from penetrating our community?
Well, it's really important. Education, as Virginia said, is really important, and we've developed a strategy. So we've partnered with the Gulf Coast High Intensity Drug Trafficking Area, which is a federally funded program, and we've just hired a overdose response strategy drug intelligence officer. We're about to hire a public health analyst who's going to sit in the Alabama Department of Public Health, and so we're communicating constantly because this is an ever morphing, evolving drug trafficking issue. It changes all the time. So we're communicating. Public safety is communicating with the public health to identify trends. The goal is to reduce overdoses. So we're constantly communicating with each other on a daily basis when we see things that are different or that are trends potentially in maybe the central part of the state that could affect later on the southern part of the state. So education is we can't arrest our way out of this. We know that, and we are going to put the traffickers in jail if we can that are selling this literally poison to our community. And but we also know that that if we can educate individuals, if we can tell them one pill can kill, hopefully they seek treatment. And so, enforcement, education, treatment is vital to reducing these overdoses.
And on the judicial process, take about 30 seconds. Do you think that you've got enough backing you up on that end, so once you arrest these people, they will be punished and kept out of the process?
Yes. If we investigate these individuals and they're brought to federal court, there's potentially harsh guidelines for selling fentanyl, especially if there's an overdose involved.
All right. Don DeSalvo, our resident agent in charge for the DA office in Mobile, we thank you so much for joining us on this part of the discussion this morning. Virginia Guy from the Drug Education Council, Executive Director. She'll be joining us in the second segment as David Grayson joins us as well as Perspectives continues on this Saturday morning. We're back this morning on Perspectives, talking to Virginia Guy with the Drug Education Council. Virginia is the Executive Director. And joining us in this segment, David Grayson. He is the Chair of Gulf Coast Families and the Opiate Epidemic. David, welcome as well this morning. Let's talk about that. Why is it now an epidemic? We hear the numbers. We know now the deaths are just unbelievable, the amount of people who've lost their lives to overdose. Tell us how the definition now, epidemic, fits to what's going on.
Hey, I'm just a dad, but I lost my daughter, Mary Catherine, several years ago to a heroin overdose. But when you look at the numbers, I don't see any other way to describe it other than an epidemic.
David, I tell you, that's one that hits very close to home, and of course our sympathies and condolences are with you on that. Tell us, when you talk to people, do they get it? Does a light bulb come on when you tell them what has happened, how close it is to you personally, and what we're dealing with?
Sometimes, but my honest reaction, moving back to Mobile, I grew up here, is the number of people who are keeping it a secret. It's almost like, well, if I don't tell anybody, then my social status won't be injured, or if I don't tell anybody, then maybe my child will find a way out of this. And that's not the way it's working. You better get help. This is deadly. It is an epidemic, and the whole stigma thing in Mobile hit me as being very dangerous. This is something where you need to speak up. There's help out there, but it's a deadly epidemic.
Virginia, when you look at these statistics and the numbers, and just recently the information came down on our pharmacies not doing their part, according to a federal jury in Ohio, that CVS, Walgreens, and Walmart saying that they didn't do enough to stop the flow of the legal, I guess you could say, prescription-based opiates. How does that play into the picture of what we're trying to deal with, both that and, of course, the illegal ones that Don mentioned in our previous segment that are also permeating the area here in South Alabama?
Well, I think when you look at the big picture, there's a lot of blame to go around. It's almost like we had the perfect storm to create this epidemic. We had the development of these very, very powerful painkillers that can be a godsend for serious pain, cancer pain, that kind of thing. But then they got out and started being abused. We started having advertisement for not being in pain. People started demanding these from physicians. Physicians started prescribing. The pharmaceutical companies were making a lot of money all through the chain. Of course, now it's gotten so deadly because it's gotten into where the big problem is now in the black market, where the fentanyl and the synthetic type of drugs are really what are killing so many of our family. And that's what we want family members to talk about, is that we want to keep all of our children safe. I know very few people who haven't been impacted by this. They either know somebody, and as David said, we really need to work on the stigma. People need to talk about this. I've never met anybody who meant to become addicted. Nobody means to become addicted. And once you are, there is treatment available. So we want people to reach out, get treatment. There's a lot of joy in a life of recovery, and there's a lot of people in Mobile that support recovery, and we can help families get the help that they need and get their person into treatment and recovery.
David, prevention tips that you tell people how to keep them, as Virginia stated there, keeping them from getting to that addicted standpoint, who are just taking it for pain prescribed properly by a doctor. What are the prevention tips that you try and get the message across to those?
You know, there's one moment in our journey that keeps haunting me, keeps coming back. At one point, Mary Catherine, my daughter, told us that she was going to try heroin. And at that point in time, we should have gone crazy. We should have gotten all the help, because it turned out that was a death sentence for her. Once she shot up heroin, she described it to me. She says, "Dad, I don't think I'm going to be able to stop doing this." And she was right. She would have periods of sobriety, but if your child gives you a signal like that, don't be like David and miss it. Overreact. Get help. This is serious. This is deadly.
My goodness. Virginia, piggybacking on that, what David is talking about, Walker County, one of the examples of a serious area in Alabama that's had some major issues. Can you speak of that and how severe things were in Walker County?
Yes, it's serious really everywhere. We're losing so many of our young people, and the people that we're losing are in the prime of their life. They're the 25 to 55-year-olds typically, and those are the people with a lot of help and hope. That are out there that have a whole life ahead of them. It's also the parenting generation. We have a tremendous number of children that are left without parents because their parent has overdosed and died,
yes.
And so they're being raised by grandparents, or they're in the foster care system. So this is affecting multi generations of our families.
And that's one of the areas that we've seen some of the national reports on that. When you talk about the effect that this has on a community, how is it affecting us here in Southwest Alabama?
I'm hearing, in fact, last week I've heard about 3 overdose deaths. That never happened a couple of years ago. The overdose deaths were kind of few and far between. Now it's becoming just too random. There's so many of them. And, the thing we don't know is some of it could be intentional. A lot of it is not intentional. It's accidental overdoses. There's also, the Narcan, which is the overdose reversal. It won't always work, but we encourage families, if they've got a family member with an addiction or taking opiates, to keep the Narcan handy, and you can possibly reduce the overdose, reverse the overdose situation. There's also just a lot of treatment and help, and as David said, make a big deal out of it. We really need, there's too many deaths, and we really need to get people into treatment.
David, take about 30 seconds and talk to those who are viewing today about where this issue is here, the epidemic, and what you are trying to get across to them. What is the message?
Well, hey, I don't really enjoy thinking about Mary Catherine's suffering, but she asked me, she said, "Dad, I think she had a inclination that this was not going to end well, and I think she knew she was going to die, and so she personally asked me to do what I could to help others." So that's what I'm doing. I'm trying to get, from a personal perspective, as just a dad, how horrible this is, how much of an epidemic it is, and it's much more deadly now than it was several years ago when Mary Catherine didn't like needles, but she would shoot up. She had a tremendous disease of addiction, and it turned out to be fatal for her.
And Virginia, in about 30 seconds, let folks know how the Drug Education Council is here for them.
Right. We provide education programs throughout the community. We also will work with families on interventions, and we provide a lot of recovery support. So our website is drugeducation.org, or you can call our office at 251-478-7855.
Virginia Guy, our Executive Director of the Drug Education Council, along with David Grayson, Chair of the Gulf Coast Families and the Opiate Epidemic, and of course our first joining us here, Don DeSalvo, who is our resident agent in charge for the DEA Mobile office. We thank all three of you so much for sharing this morning, and hopefully we were able to reach a few people today to make a difference in our community. Thank you for joining us today.
Thank you.
Thank you.
And for more information on the continuing fight against the opiate epidemic, you can contact the folks at the Drug Education Council. The phone number and website information you see is there on the screen. And of course, check out the Facebook page of Gulf Coast Families and the Opiate Epidemic. The page is a safe place to read and share stories from families that have been affected both in the U.S. and here on the Gulf Coast. Next up on Perspectives, Dr. Martin Luther King Jr., civil rights leader and Nobel Peace Prize winner, would be 93 years old this month if not assassinated back in 1968. His I Have a Dream speech, civil rights activists and others say, brought awareness and humanity to the national consciousness about civil rights in America. In 1963, he worked closely with the NAACP in Birmingham, organizing sit-ins in public spaces. The successful campaign led to the city desegregating its public spaces. Now, 59 years later, we talk with the Alabama NAACP state president to find out what the civil rights organization's focus is today and considering the political and social environment, its challenges. Well, please join us here next Saturday morning at 9 again for Perspectives as we discuss important issues and seek solutions. And of course, reach out to us if you have any ideas of topics. I'm Eric Reynolds. Have a great week ahead.
Thanks for watching Fox 10 News. Watch us live wherever you are, on our mobile, our streaming news app, and you can also watch us on Roku, Apple TV, and Fire TV.